Hi guys, welcome back to the channel. It's fantastic to see you. Welcome back to what I believe could very well be the final vlog, the final video in Latvia. I'm currently at my place, obviously. It's really messy, I do apologise, but yeah, I'm just cleaning up and well, you could do a better job of cleaning. I'm cleaning up my apartment and packing my stuff. I'm getting ready to fly off home in a few days. So, as this is the final video, like I just said, I think that we should do a throwback and speak about... If it was up to me, I'd make it obligatory for people that move into their clinical years to be able to speak a certain level of the language. Now, I know the pandemic has affected that and some people haven't actually been here or weren't here for years, but that's irrelevant to me. Let me explain why. So picture this, right? You've just finished your pre-clinical years, or pre-clinics, some of you people like to say, and you're moving on to clinical rotations and stuff, and you're in the hospital here, and you are kind of expected to have your own patients, discuss, ask, inquire, examine, and if you haven't learned the language at all, then that's going to be a problem. Now, I know in your pre-clinic years, you've got stuff to do, like biochemistry, anatomy, and there's this annoying subject called Latvian language that's always there, and you just don't have time for it. Now, I get it. Now, what I'm trying to stress is that you don't have to slave over it, and you don't have to spend hours and hours. My best tip would be to just, have an ear open, just be receptive, just be proactive and want to learn about just basic terms, basic phrases, basic questions, and that will really help in the long run. Now, I know some CGGs, some chilled guys or chilled girls are going to come up to you. I guarantee you this will happen because there's so many of them. I can't say that, but not even them, but just way too many people say I will not learn Latvian, I will not learn Lettish, internship and blah. Getting a little bit carried away there, but there's a problem with it, and here's why. Firstly, if you are one of those people, if you don't want to learn Latvian or whatever, the local language, whatever, that's fine, and you do you, but the moment that gets said so much, it puts a seed of doubt in people's minds, especially younger on in their academic careers, that they shouldn't, and they're not informed why they shouldn't. It just spreads like BS, and it's not true, and I'm going to tell you why it's not true and why it is imperative that you at least keep your ears open. I'm sorry about my voice, it's really raspy. I've been recovering from man flu for about 6 days, and this is the first day that I'm actually up and able to speak to you guys properly. So here's the crux, and here's the most important reason why, is that, okay, so your fine self, you have chosen, or you chose to come to Latvia and study medicine. That's on your own accord, right? Obviously, when you go to a hospital or you're in a clinical rotation, patients shouldn't be, or we shouldn't have this expectation that they should speak our language, whatever our first language may be. So it's firstly out of courtesy that we should try and communicate with them. And secondly, the most important thing, and I can't stress the importance of this enough, as we move up through our clinical years, we learn, we appreciate the importance of taking a structured, thorough, well thought through medical history and thinking, okay, so this is what the patient told me, and being able to think logically and thinking what questions you're going to ask. If you don't practice that because you can't understand what's going on and you're still progressing through the years, isn't that a big shame? You're going to be missing out on so much, and so you only get that exposure and you only get better at it by doing it. If we can't be bothered and we listen to those people, then you're missing out, and you're missing out for yourself. I know some people are going to come back and throw something back at me and say yeah, but in state exam I get translator book. My honest advice to you is get to a point where you don't need a translator book, and there's a reason why I say that, and I'm not that good. Trust me, I'm not that like as good as a book, obviously, but the reason why I say that is we can all aspire to be better without having to depend on something. When you get to that stage of collecting histories and whatever, visiting patients, basic questions should roll off the tongue, right? And so if you're sat there in an exam or at a patient bed and you're having to look things up, that's not just a lack of understanding, like I said, in the language, that's a lack of understanding of your clinical kind of thinking. Like, is this question necessary? Do I need to ask this? Obviously, every patient's different and every history requires, you know, a tailor-made outfit, but essentially there's always a skeleton in your head that you kind of go through. I think, well, in my head there is, at least. So that's all well and good, Dillon, but how do you do it? How do you kind of build on your understanding of the Latvian language to help me, to help you? Well, after you do it for the first year and a half, those first 3 semesters or something, every time I had an option to pick it as an elective course, way up until 6th year, I think, I chose it, right? So that's not because I wanted to learn new things, that's because I wanted to keep what I'd learned in those first 3 semesters ticking over so I don't forget it. Sorry, it's getting dark, but yeah, like, it's a shame, like I don't think I'll ever use this language ever again, obviously, unless, you know, I bump into someone that's Latvian and we have a conversation about medicine, I suppose. But honestly, like, some of the best memories from my academic career in hospitals here was honestly just going into a patient's room, you know, checking up on them, speaking to them, and following up with them and building up a professional relationship. And that's, yeah, that's definitely one of the highlights of my degree, hands down. So guys, I hope that helped somewhat. I hope what I'm trying to say is clear and somewhat understandable. Thanks for watching over the last 2 years. It's been absolutely incredible. Oh my gosh, it's so dark. Even if you don't agree with the topic in this video, even if you think I'm full of, let me know in the comments, and let me know why. I'd be interested to know why you disagree. And yeah, if you hear CGGs going on about it, tell them they should consult.
Got back from Barcelona.
And tell them Uncle Way sent you. So yeah, guys, please give it a like if you did enjoy it. Comment down below. I'd love to hear from you. Subscribe if you are new and you would like to see more. And to this beautiful country, I say thank you very much for having me. We'll see you next time. Take care. Peace. Bye.